You mentioned also mouth breathing, and from a brain perspective, mouth breathing, sleep apnea, these are really, really hard on the brain. If you have sleep apnea, it's essentially mild brain damage every night. And we need to address this really quickly. But I know that also mouth breathing has a big effect on the oral microbiome. And so I'd love to hear from your perspective, especially Michelle, like with kids, do you notice kids that mouth breathe, there's repercussions from that in the oral health? Barbara, like how do you suggest that patients deal with that? I'm just so curious your perspectives on it.
Sure, I can jump in on children. As you all know, or maybe you don't know, children tend to get more caries than periodontitis, gingivitis. So they tend to get more caries. Adults tend to get, in general, more periodontitis. So in kids, the oral microbiome can be carious forming, and that mouth breathing seems to perpetuate that further, the oral dysbiosis. So what I really work on with children, of course, is to alkalinize the mouth, which to decrease the acidity, which would hopefully prevent the kind of the erosion of the enamel. So I talk a lot about diet, removing the binky, getting rid of bottle feeding, not hanging on the breast, forever as a pacifier, all those techniques. But I work very aggressively, using, diet first, hydration second, getting rid of all the appliances when possible, the binky, the bottle when appropriate. I use a lot of homeopathics, which I'll just put that on the side to kind of rebalance the microbiome. Lots of ferments, they're my favorites, and lots of probiotics for kids. And there are techniques, the Butenko method, there are methods where we can get people to learn how not to mouth breathe, but they're a little bit harsh, and parents can be somewhat reluctant to do some of these techniques because they sound somewhat barbaric, trying to get kids not to mouth breathe. We have to make sure that kids don't have enlarged tonsils and adenoids, because if they can't breathe through their nose, they may have adenoidal hypertrophy, which are essentially enlarged adenoids, and just all this glandular tissue is inflamed, and that could be from chronic infection, from mold exposure, dairy sensitivities. That's probably the biggest one, if you want to know the truth, is sensitive to dairy, where all this lymphoidal hypertrophy is what we call it, which is essentially enlarged adenoids, which can block the breathing. So if kids can't breathe, you can't work on getting rid of mouth breathing. So we have to address the nasal problem first. And I always start with diet. I think every patient I ever have seen, I start with a diet, no matter what we're talking about. So I'm a big fan of giving kids even sodium bicarbonate in their toothpaste, having moms and dads make even their own toothpaste, and kind of trying to create a new milieu and reduce the carious teeth microbes. The main one for kids is strep mutans. That tends to be a big player, and it tends to even live on their tonsils. So when kids can't get rid of it in their mouth, we have to make sure we address what's in the tonsils.
Yes. The mouth breathing drops the pH. It reduces the salivary flow, so you're not getting remineralization. You're not getting the healing that you need to have a healthy tooth structure, and also for healthy gums. The tissue dries out. We don't get that moisture in there, and it is, we've got to start our kiddos right from the get-go with nasal breathing, and they mimic what parents do. I see parents sitting there with their mouth open. The kids do that. And that's where, myofunctional therapy, working with a myofunctional therapist to teach them how to use their nose. 50% of the population is walking around with their mouth open, and they're mouth breathing. And, I tell the kids, your nose is for breathing, your mouth is for eating, and we're not going to confuse the two. You can't have a healthy mouth if you're mouth breathing. So myofunctional therapy is critical for this as well.